Hello everyone. Welcome to GHEIL Forum channel. This is Yuvarajan Subramaniam from Global Health Education and Innovative Learning Forum channel. This video provides a general introduction to emerging respiratory viruses, including novel coronaviruses. By the end of this video, you should be able to describe the nature of emerging respiratory viruses, how to detect and assess an outbreak, strategies for preventing and controlling outbreaks due to novel respiratory viruses, what strategies should be used to communicate risk and engage communities to detect, prevent and respond to the emergence of a novel respiratory virus. Before getting into this video, kindly subscribe GHEIL Forum channel for notification alert and click the thumb symbol in case you like the video. Give your valuable comments for better improvement and share this video link to your friends, colleagues, people who work in development and healthcare sectors. Let us start the session. The coronavirus pandemic has reached almost every country in the world. Its spread has left national economies and businesses counting the costs, as governments struggle with new lockdown measures to tackle the spread of the virus. Despite the development of new vaccines, many are still wondering what recovery could look like. The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome coronavirus 2. The virus was first identified in December 2019 in Wuhan, China. The World Health Organization declared a public health emergency of international concern regarding COVID-19 on 30th January 2020, and later declared a pandemic on 11th March 2020. As of 20th April 2021, more than 142 million cases have been confirmed, with more than 3.03 million deaths attributed to COVID-19, making it one of the deadliest pandemics in history. Severe acute respiratory syndrome coronavirus 2. Severe acute respiratory syndrome coronavirus 2 is the virus that causes COVID-19, the respiratory illness responsible for the COVID-19 pandemic. It is a positive single-stranded RNA virus that is contagious in humans. It is believed to have zoonotic origins and has close genetic similarity to bat coronaviruses, suggesting it emerged from a bat-borne virus. Research is ongoing as to whether severe acute respiratory syndrome coronavirus 2 came directly from bats or indirectly through any intermediate hosts. The virus shows little genetic diversity, indicating that the spillover event introducing severe acute respiratory syndrome coronavirus 2 to humans is likely to have occurred in late 2019. What is coronavirus? Coronaviruses are a family of viruses that cause illness such as respiratory diseases or gastrointestinal diseases. Respiratory diseases can range from the common cold to more severe diseases. For example, Middle East respiratory syndrome and severe acute respiratory syndrome. A novel coronavirus is a new strain that has not been identified in humans previously. Once scientists determine exactly what coronavirus it is, they give it a name, as in the case of COVID-19. The virus causing it is severe acute respiratory syndrome coronavirus 2. Coronaviruses got their name from the way that they look under a microscope. The virus consists of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. The word corona means crown in Latin. Coronaviruses are zoonotic, meaning that the viruses are transmitted between animals and humans. It has been determined that Middle East respiratory syndrome coronavirus was transmitted from dromedary camels to humans and severe acute respiratory syndrome coronavirus 2 from civet cats to humans. The source of the severe acute respiratory syndrome coronavirus 2, that is COVID-19, is yet to be determined, but investigations are ongoing to identify the zoonotic source to the outbreak. Signs and symptoms. Symptoms of COVID-19 are variable, ranging from mild symptoms to severe illness. Common symptoms include headache, loss of smell and taste, nasal congestion and runny nose, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. People with the same infection may have different symptoms, and their symptoms may change over time. 3 common clusters of symptoms have been identified. 1. Respiratory symptom cluster with cough, sputum, shortness of breath, and fever. 2. A musculoskeletal symptom cluster with muscle and joint pain, headache, and fatigue. 3. A cluster of digestive symptoms with abdominal pain, vomiting, and diarrhea. In people without prior ear, nose, and throat disorders, loss of taste combined with loss of smell is associated with COVID-19. Over 81% of people develop mild to moderate symptoms, up to mild pneumonia, while 14% develop severe symptoms, dyspnea, hypoxia, or more than 50% lung involvement on imaging, and 5% of patients suffer critical symptoms, respiratory failure, shock, or multi-organ dysfunction. At least a third of the people who are infected with the virus do not develop noticeable symptoms at any point in time. These asymptomatic carriers tend not to get tested and can spread the disease. Other infected people will develop symptoms later, called pre-symptomatic, or have very mild symptoms and can also spread the virus. As is common with infections, there is a delay between the moment a person first becomes infected and the appearance of the first symptoms. The median delay for COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after exposure, and almost all will experience at least one symptom within 12 days. Most people recover from the acute phase of the disease. However, some people continue to experience a range of effects for months after recovery, named long COVID, and damage to organs has been observed. Multi-year studies are underway to further investigate the long-term effects of the disease. The virus that causes COVID-19 spreads mainly when an infected person is in close contact with another person. Small droplets and aerosols containing the virus can spread from an infected person's nose and mouth as they breathe, cough, sneeze, sing, or speak. Other people are infected if the virus gets into their mouth, nose or eyes. The virus may also spread via contaminated surfaces, although this is not thought to be the main route of transmission. The exact route of transmission is rarely proven conclusively, but infection mainly happens when people are near each other for long enough. People who are infected can transmit the virus to another person up to 2 days before they themselves show symptoms, as can people who do not experience symptoms. People remain infectious for up to 10 days after the onset of symptoms in moderate cases and up to 20 days in severe cases. Transmission of COVID-19. transmission of COVID-19 is the passing from person to person of coronavirus disease 2019. The virus is transmitted mainly through the respiratory route after an infected person coughs, sneezes, sings, talks or breathes. A new infection occurs when virus-containing particles exhaled by an infected person, either respiratory droplets or aerosols, get into the mouth, nose, or eyes of other people who are in close contact with the infected person. During human-to-human transmission, an average 1,000 infectious severe acute respiratory syndrome coronavirus 2 variants are thought to initiate a new infection. The closer people interact, and the longer they interact, the more likely they are to transmit COVID-19. Closer distances can involve larger droplets, which fall to the ground, and aerosols, whereas longer distances only involve aerosols. Larger droplets can also turn into aerosols, known as droplet nuclei, through evaporation. The relative importance of the larger droplets and the aerosols is not clear. However, the virus is not known to spread between rooms over long distances such as through air ducts. Airborne transmission is able to particularly occur indoors, in high-risk locations such as restaurants, choirs, gyms, nightclubs, offices, and religious venues, often when they are crowded or less ventilated. It also occurs in healthcare settings, often when aerosol-generating medical procedures are performed on COVID-19 patients. Although it is considered possible there is no direct evidence of the virus being transmitted by skin-to-skin contact. A person could get COVID-19 indirectly by touching a contaminated surface or object before touching their own mouth, nose, or eyes, though this is not thought to be the main way the virus spreads, and there is no direct evidence of this method either. The virus is not known to spread through feces, urine, breast milk, food, wastewater, drinking water, or via animal disease vectors, although some animals can contract the virus from humans. It very rarely transmits from mother to baby during pregnancy. Social distancing and the wearing of cloth face masks, surgical masks, respirators, or other face coverings are controls for droplet transmission. Transmission may be decreased indoors with well-maintained heating and ventilation systems to maintain good air circulation and increase the use of outdoor air. It has been suggested that improving ventilation and managing exposure duration can reduce transmission. Diagnosis: COVID-19 testing. COVID-19 can provisionally be diagnosed on the basis of symptoms and confirmed using reverse transcription polymerase chain reaction, that is RT-PCR, or other nucleic acid testing of infected secretions. Along with laboratory testing, chest CT scans may be helpful to diagnose COVID-19 in individuals with a high clinical suspicion of infection. Detection of a past infection is possible with serological tests, which detect antibodies produced by the body in response to the infection. Countries around the world develop tests independently and in partnership with others. The standard methods of testing for presence of SARS-CoV-2 are nucleic acid tests, which detects the presence of viral RNA fragments. As these tests detect RNA but not infectious virus, its ability to determine duration of infectivity of patients is limited. The test is typically done on respiratory samples obtained by a nasopharyngeal swab. However, a nasal swab or sputum sample may also be used. Results are generally available within hours. The WHO has published several testing protocols for the disease. Prevention. Preventive measures to reduce the chances of infection include staying at home, wearing a mask in public, avoiding crowded places, keeping distance from others, ventilating indoor spaces, managing potential exposure durations, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands. Those diagnosed with COVID-19 or who believe they may be infected are advised to stay home except to get medical care. Call ahead before visiting a healthcare provider. Wear a face mask before entering the healthcare provider's office and when in any room or vehicle with another person. Cover coughs and sneezes with a tissue. Regularly wash hands with soap and water and avoid sharing personal household items. A COVID-19 vaccine intended to provide acquired immunity against severe acute respiratory syndrome coronavirus 2. The virus causing coronavirus disease 2019, COVID-19. Prior to the COVID-19 pandemic, there was an established body of knowledge about the structure and function of coronaviruses causing diseases like severe acute respiratory syndrome and Middle East respiratory syndrome, which enabled accelerated development of various vaccine technologies during early 2020. On 10th January 2020, the SARS-CoV-2 genetic sequence data was shared through GHEIL, and by 19th March, the global pharmaceutical industry announced a major commitment to address COVID-19. In phase 3 trials, several COVID-19 vaccines have demonstrated efficacy as high as 95% in preventing symptomatic COVID-19 infections. As of April 2021, 13 vaccines are authorized by at least one national regulatory authority for public use, 2 RNA vaccines, the Pfizer-BioNTech vaccine and the Moderna vaccine, 5 conventional inactivated vaccines, BBCOV, CoronaVac, Covaxin, WebCov and Covivac, 4 viral vector vaccines, Sputnik V, the Oxford AstraZeneca vaccine, CoVID-19, and the Johnson & Johnson vaccine, and 2 protein subunit vaccines, Epivac Corona and RBD-Dimer. Many countries have implemented phased distribution plans that prioritize those at highest risk of complications, such as the elderly, and those at high risk of exposure and transmission, such as healthcare workers. As of 17th April 2021, 890.31 million doses of COVID-19 vaccine have been administered worldwide based on official reports from national health agencies. AstraZeneca Oxford anticipates producing 3 billion doses in 2021, Pfizer-BioNTech 1.3 billion doses, and Sputnik V, Sinopharm, Sinovac, and Johnson & Johnson 1 billion doses each. Moderna targets producing 600 million doses and CoVID-19 500 million doses in 2021. By December 2020, more than 10 billion vaccine doses had been pre-ordered by countries, with about half of the doses purchased by high-income countries comprising 14% of the world's population. The pandemic has resulted in significant global social and economic disruption, including the largest global recession since the Great Depression. It has led to widespread supply shortages exacerbated by panic buying, agricultural disruption and food shortages, and decreased emissions of pollutants and greenhouse gases. Numerous educational institutions and public areas have been partially or fully closed, and many events have been cancelled or postponed. Misinformation has circulated through social media and mass media. The pandemic has raised issues of racial and geographic discrimination, health equity, and the balance between public health imperatives and individual rights. I hope this video will be useful, and thank you so much for watching this video. Kindly click the like button in case you feel useful, and give your valuable comments for better improvement. Please subscribe this channel and share this video link to your friends, colleagues, people who work in development and healthcare sectors.